I'm Malcolm Peat. I'm the Executive Director of the International Centre for the Advancement of Community-Based Rehabilitation. We have worked at Queen's internationally for a number of years, over 25 years, focusing on disability. And there's a whole range of projects of specific aspects of disability that would be involved in, at different locations, different cultures. The problem that we're focusing on in Bangladesh is merging two groups, that is, those professionals and people in the community working on maternal and child health, mothers, infants, children, families, village communities, with the focus on the woman who's about to give birth in the environment of Bangladesh, where the health services are extraordinarily taxed. The second part of this partnership is disability. Bangladesh has, like many countries, they have a significant problem in dealing with disability at all levels, from the elderly, children, infants. Now, it's quite likely that in most of the areas where we're working, the health professionals in the maternal and child health group will not have met the professionals in the disability treatment group. And so what we want to do is to marry the skills and needs of the people working in maternal and child health with the people working on disability, with their skills and their understanding of how to prevent some of the disabilities that could potentially occur in an infant following birth, or disabilities that might impact on the woman herself in the process or after giving birth. So we're taking the opportunities of disability programs and marrying them to the needs of maternal and child health. In addressing the problem, there are a number of critical components. One is entering the community and working with them on a partnership basis. That's very important, to have them accept us, to understand what we want to do, so that our objectives and their objectives are exactly the same. The second thing is that we have to work with professional partners. The traditional birth attendant, the midwife, the doctor in the community, the people who work in the disability community, this is their community. This is where they live, this is where they practice. One of the interesting parts of it is that we're working at the grassroots with hundreds of people, ultimately. So we've got to bring representatives of the different constituencies together. And so we use what's often referred to as the training of teachers approach, where we give the information to one group, they then spread it, and ultimately it reaches hundreds of people in the districts in Bangladesh in which we're working. And so what we're doing is we're running a series of modules in which we bring together all the partners. It's like seeing an opera in acts. Act one, which is you introduce all the team. We have a pediatrician, we have a midwife, we have an occupational therapist, we have a physical therapist, we have a social worker, we have a person with a disability who's experienced of this. Act two is you begin with a series of issues or processes that the mother will face prenatally, then the birth process itself, and then in the postnatal days after the birth. And so our team fits in with the different processes that the mother and child will have and the different clinical issues that can be faced at each step, and the information is given by the expert in that particular area. So we take a series of complementary skills and we put them together in a logical framework and sequence. So you've got a series of building blocks, one after the other, which make a whole sense of what it's all about. We hope at the end of the day it makes sense to everybody. It's a continuum of learning. There are a number of disabilities in the early years of life. There are orthopedic disabilities that can affect growth and development, like clubfoot. There could be congenital dislocation of the hip. There could be a cerebral palsy, that's possible. So one of the things that we would want to educate people are on being able to recognize signs in the child or in the infant they might not otherwise have noticed. This will be things that routinely they'll look for now. What we want to do is just to raise the capacity of the community and of the health professionals who are working at that level. One of the, it's a thing I've already mentioned, and that is the importance of looking at issues like this as a wonderful example of how health professionals work together. You know, we see health often as people doing individual things in their own capacity, in their own practice. I think when we work at the community level like this is a wonderful opportunity for health professionals to share their experiences, to teach each other, and so enhance the ability of all of them to address the issues in a more effective way. So interdisciplinary practice, I think, is the essence of what a project like this has to have. So in that sense, we believe it's quite innovative for Queen's and our Bangladesh partners to do this.